Basically, we started the topic heart. So we studied about basics. Let's continue the lecture, chambers, vessels, and valves. In that we discuss, we have four chambers and two vessels. Okay, this is the right ventricle, left atrium, left ventricle. This is the tricuspid valve. Sorry, this is the interventricular septum. Here we have interauricular septum. Okay, uh, which divides atrium, which divides ventricles. Okay, understood till here. So now we will talk about each and every valve. Okay, and each and every chamber. And we have to remember and valves. Okay, we have valves. This is the valve here, number one. What does valve do? It it is like door. So nowadays we have automatic doors now. So if we push them, automatically it will close. Okay, or else in malls we have sensory doors. Whenever you will go the next to the door, the doors open automatically. So here we have the doors. Okay, from one chamber to another chamber. Okay, so here we have this is tricuspid valve. This is tricuspid valve. This is bicuspid valve. Okay, so here we have the two valves within the ventricles, artery, within the atrium and ventricle. Upper portion is the lower portion, upper portion, lower portion, atrium and ventricle. So this is the you have to remember. Here we have three valves. So that's the reason we have tri. Here we have two valves. That is the reason we will call bicuspid valves and tricuspid valves. So I think you understood. Now we will talk about each and every chamber of the heart in detail. Here we have the right atrium. So I think you all draw the heart structure with chambers. So you did that. Hello.
Yes, sir.
Okay, good. So then only you will able to understood. Okay, the diagram will explain you how is the heart. Okay, so basically right atrium. This is the right atrium. Okay, now we will talk in detail about right atrium. So the two large caval veins return blood from the body to the right atrium. So what is the main function of right atrium? Here we have the large artery. Here we have this is the large artery. Okay, this is the large artery. This name is superior vena cava. What is that name? Superior vena cava. So from that vena cava, this is very large artery. Okay, so from that artery, the blood enters into the atrium from the body. It is coming from the body. Okay, it is coming from the body to the right atrium. This is the first thing you have to remember. Second thing, the superior vena cava carries blood from the upper body. Okay, and the inferior vena cava carries blood from the lower body, from the right atrium. Blood will flow through the right atrioventricular valve, AV valve or tricuspid valve into the right ventricle. Okay, so here we have the remember here we have the two vena cavas, superior vena cava, inferior vena cava. Superior vena cava, what it do? It take the blood from the lower part of the body, lower part of the body, and it took blood from the upper part of the body, and the blood will reach to the atrium. Okay, lower part of the body, upper part of the body, and it will reach to the atrium. So here we have the atrium. From that, it will reach to the right ventricle with the help of this valve. There are two names, AV valves and tricuspid valve. AV means atrioventricular. This is the atrioventricular valve or AV valve in short. So whenever you will see the reports, they are not uh, all terms in uh, full form. They will give short forms, AV, TV. So then you have to understand AV valves means atrioventricular valve. TV, they will give TV. They will not give tricuspid valve. You have to study and you will understood. No, no. So in the report, they only give TV. So you have to understood. You have to mention. You have to observe all these terms, which is very important. Okay. The tricuspid valve is made up of three flaps or cusps of endocardium reinforced with connective tissue. The general purpose of all valves in the circulatory system to prevent backflow of blood. The specific purpose of tricuspid valve is to prevent backflow of blood from the right ventricle to the right atrium. When the right ventricle contracts, as the ventricle contracts, blood is forced behind the three valve flaps, forcing them upward and together to close the valve. So this is the one thing you have to remember. Second thing, why does we have valves? So I already told you it is like door, open door. But in door, the door can be opened from the back side as well as front side. You have to from front side you have to push, from back side you have to pull. Okay. But here this is the only one way door. Blood can flow from right atrium to right ventricle, but it cannot flow from right ventricle to right atrium. So this is the many very important. Okay. So blood is have to flow forward, not backward. So there's the prevention from of blood from backward to frontward. So we have valve. Okay, the blood can flow backward. So the valves are closed. So then the reason was would happen. The blood in the right ventricle will stay here only, and it will go forward, whatever the necessary required. Okay, understood. Right atrium. So three things we have to remember about right atrium. We have superior vena cava, inferior vena cava, and we have valve. These are the three things you have to remember. Okay, and another thing here not mentioned that is the blood is coming to the right side of the heart is deoxygenated. What is that blood? Deoxygenated. Deoxygenated. DO2. Deoxygenated blood will come into the right atrium from all parts of the body through superior vena cava or inferior vena cava. Then it will enter into the ventricles, right ventricle. Then it will go to the lungs. So lungs, from that we have lungs. From lungs we need oxygen. So oxygen will mix with this blood and it will reach into the left atrium. From left atrium, it will reach to the left ventricle. From left ventricle, it will reach to the all parts of the body. This is a simple function of the heart. Simple function. So, right side heart have deoxygenated blood. Left side heart have oxygenated blood. This is the thing. One thing you have to remember. Second thing is that in the right heart, first deoxygenated blood come from all parts of the body into the right atrium. Then it will enter into the right ventricle. Then it will go to the lungs. Then oxygenated blood, oxidization or oxygen will enter or reach to the blood. Then it will go to the left atrium to left ventricle to all parts of the body. So this is the normal function of every heart. So let's talk in uh, theoretical way. This is the practical way I teach you. So in 1-2 lines, it completed. Now, what is the matter is given here? We will study. So लेफ्ट एट्रियम, सो आई विल रिपीट इन हिंदी फॉर 1 मिनट। सो बेसिकली यहाँ पे देखिए ये हार्ट है। ये हार्ट में दो पार्ट्स हमने बताया था कि 4 चैम्बर्स है। एक राइट एट्रियम, राइट वेंट्रिकल, लेफ्ट एट्रियम, लेफ्ट वेंट्रिकल। तो बेसिकली लेफ्ट और राइट को डिवाइड करने के लिए, और ये एट्रियम को डिवाइड करने के लिए और वेंट्रिकल को डिवाइड करने के लिए हमारे पास ये दीवार है, चैम्बर्स है। तो इसको कहेंगे इंटर वेंट्रिकुलर सेप्टम। क्योंकि ये वेंट्रिकल के बीच में है इसलिए इंटर का लफ्ज लाया गया। ये दोनों के बीच में वेंट्रिकल्स, एट्रियम है, एट्रियम के बीच में, इसलिए इंटर एट्रियम सेप्टम था। ठीक है, अब यहाँ पे दोनों राइट साइड को डिवाइड करने के लिए एक वाल्व रखा गया, ट्राइकस्पिड वाल्व, यहाँ पे बाइकस्पिड वाल्व। तो राइट एट्रियम के बारे में पहले हम डिस्कस करेंगे कि ब्लड जो है इंफीरियर वेना केवा, सुपीरियर वेना केवा, या वेना केवा के माने हैं ऐसा लार्ज वेन जो सुपीरियर ऊपर से ऑर्गन को लेकर आता है राइट एट्रियम में। इंफीरियर के माने निचले हिस्से से एक बड़ा वेन जो निचले हिस्से से खून को लाकर राइट एट्रियम में डालता है। ठीक है, तो इससे मालूम हो गया हमें ब्लड कहाँ पे पहले मर्तबा आएगा, वो है राइट एट्रियम। सो उसके बाद ब्लड जो है आगे जाएगा वेंट्रिकल, ये इसमें वेंट्रिकल में, राइट वेंट्रिकल में। यहाँ पे प्रिवेंट करने के लिए ब्लैक फ्लो, ताकि ब्लड जो है पीछे ना आ जाए, उसको बचाने के लिए यहाँ पर राइट वेंट्रिकल और राइट एट्रियम के बीच में वैल्व रखा गया जिसको कहा जाता है ट्राइकुस्पिड वैल्व। अब इसके शॉर्ट फॉर्म्स याद रखना है, टीवी कहेंगे। ठीक है, और इसका और एक नाम है एट्रियो वेंट्रिकुलर सेप्टम, और चैम्बर और वैल्व, जो कि एवी वैल्व भी कहते हैं इसको। ठीक है, अब बात करेंगे हम लेफ्ट एट्रियम, सॉरी लेफ्ट एट्रियम, नॉट राइट वेंट्रिकल, सो विल कंफ्यूज। So I will teach you right ventricle. So we'll talk about right atrium. Now we'll talk about right ventricle. When the right ventricle contracts, the tricuspid valve closes and the blood is pumped to the lungs through the pulmonary artery. At the junction of this large artery and the right ventricle is pulmonary semilunar valve, PV valve. Okay. Its three flaps are forced upon when the right ventricle contracts and pumps blood into the pulmonary artery. When the right ventricles relax, blood tends to come back, but it fills the valve flaps and closes the pulmonary valve to prevent blood flow of blood into the right ventricle. So basically, what we have to remember here that, so basically I told you that blood will come from upper part, from lower part into the ventricle. So from here, the blood will enter into the right ventricle. So from here, it will go to the lungs. So we have the lungs here. So from here, we have to go to the lungs. So basically, so here we have, okay. So basically from here, the lungs will, the blood will reach to the lungs with the help of, what is this name? This is the name is pulmonary artery. So here you have to remember one artery is there which takes the blood from the heart to the lungs. This blood is deoxygenated, but its name is pulmonary artery, PA. So again we have valve here. Okay, again valve here like semilunar, like this. Semilunar, half. Lunar means uh, lunar means moon. Semi means half, like half moon. We will able to see the valve. Okay, it will reaches to the lungs, then oxygenated. The blood will oxidize, and it will reach to the right, sorry, left atrium. So here you understood. But second thing you have to remember that. So second function, what will the function? Whenever heart have the two functions, one is contraction, okay, one is relaxation. When blood contracts, okay, when contracts, the blood in the here Here contraction will occur. Okay. Here contraction, main contraction is here only. Whenever contraction occurs, what will happen? Blood will go forward. Okay, blood go forward. So this valve have to be closed, tricuspid valve, because the blood will go to forward, not backward. Okay, not backward. So this valve may be closed. But here you have pulmonary valve, it is open. Okay, which is semilunar, you have to be open. So blood from this chambers, it will go forward. So this valve will open, this valve will close. Okay, because the blood will not enter into this chamber. Okay, understood. So projecting into the lower part of the ventricle are columns of myocardium called papillary muscles. Standards of fibrous connective tissue, the chordae tendineae, extend from the papillary muscles of the flaps of the tricuspid valve. When the right ventricle contracts, the papillary muscles also contract and pull to the chordae tendineae to prevent inversion of the tricuspid valve. If you have ever had your umbrella blown inside out by a strong wind, you can see what would happen if the flaps of tricuspid valve were not anchored by the chordae tendineae and papillary muscles. So basically, if you see anatomy of the heart, so that here we have the tricuspid valve. So it is connected along with this heart muscles. Okay, this the muscles are chordae tendineae. So let's see here. Not imagine my image is not given. So let's see. Mm. So this you can see. So this is the heart muscles. So here our heart muscles are connected to the. This is the muscles, papillary muscles. These are the endocardium. Okay, endocardium. This is papillary muscles are attached to the mitral valve. So if this muscle contract, okay, like this contract, so contract it will contract. If it is contract, it is relaxed. Okay, if it is relaxed, it is contracted. Okay, it is opened. So like this. So like upon the heart functions. In this image also very clear picture is given, so I will save this image. So here we have the very good image, you can able to see. So these are the valves. Okay, this is the valve, and this is the chordae tendineae. This is the chordae tendineae. It is attached to the muscles of the heart. So contraction, relaxation. When it is relaxed, it is open. When it is contract, it is closed. Okay, here also same thing happen. Okay, I think you understood. You have to draw the image for fulfilled understanding. Okay. When the right ventricle contracts, the papillary muscles also contract and pull on the chordae tendon to prevent inversion of the tricuspid valve. If you have ever had your umbrella, so I told you. Okay. So next we will come to left atrium. So from this part, the blood reach to the lungs with the help of pulmonary valves. Okay, pulmonary valves. This is semi-lunar. So the blood reach to the lungs. It is oxidized, means oxygen is mixed with the blood. So then it will reach to the left atrium. Okay, with the help of, you can see here, with the help of pulmonary veins. So you have four pulmonary waves. How many? You have the four pulmonary waves. From that region, the blood enter into the left atrium. Okay. The blood will then flow into the left ventricle through the left atrioventricular valve, also called mitral valve or bicuspid valve. The mitral valve plunges black flow of blood from the left ventricle to the left atrium. When the left ventricle contracts, another function of the atria is the production of hormone involved in blood pressure maintenance. When the walls of the atria are stretched by increased blood volume and blood pressure, the cells produce atrial nit nitriuretic peptide, also called atrial nitriuretic hormone. The ventricles of the heart produce a similar hormone called B-type nitriuretic peptide or BNP, but we'll use ANP as the representative cardiac hormone. ANP decreases the reabsorption of sodium ions by the kidneys so that more sodium ions are excreted in urine, which in turn increase the elimination of water. The loss of water lowers blood volume and blood pressure. You may have noticed that ANP is an antagonist to the hormone aldosterone, which raises blood pressure. So basically, the blood will reach to the atrium and it will reach to the ventricle, left ventricle, with the help of this valve. This valve is known as mitral valve or bicuspid valve. Mitral valve or bicuspid valve. So what will happen? So one thing is that when atrium is contract, what will happen? Atrium is contract. One hormone is released, that is ANP or ANH. What does it do? It will lower the blood pressure. And second thing, it will decrease the absorption of sodium. So then the sodium will release from the body. So blood volumes decreases. Blood means blood. If it's blood volume means 4 5 liters is there. 4.9 liters will happen. Then what will happen? The blood pressure decreases. So that's the way of decreasing blood pressure in the body will happen. Okay. So this is the function of left atrium. Now we'll talk about left ventricle. So here we have the left ventricle. The blood from the lungs reach to the left atrium and it will reach with the help of mitral valves into the left ventricle. Okay. Here from that it will go forward to the whole body. It will send the blood to the whole body. What will the other functions? Let's see here. The valves of left ventricle are thicker than those of the right ventricle, which enables the left ventricle to contract more forcefully. The left ventricle pumps blood to the body through the aorta, the largest part of the body. At the junction of the aorta and the left ventricle, aortic semilunar valve. This valve is opened by the force of contraction of the left ventricle, which also closes the mitral valve. The aortic valve closes when the left ventricle relaxes. To prevent black flow of blood from the aorta to the left ventricles when the mitral valve closes, it prevents black flow of blood to the left atrium. The flaps of the mitral valve are also closed, also anchored by caudate tendine and papillary muscles. All of the valves are shown. This is TPs of fibrous retinal that this is fibrous connective tissue that anchor the out hatch. Okay. So basically, second thing is here that simply you have to understood. From that we have uh, aorta. Here we have aorta. In that we have aortic semilunar valve is there. So you have to close when it is relaxed. You have to open when it is contract. So this is all opposite to each other. Mitral open, it's closed. When it is open, it's closed. So this is the function of the heart. Normally, we have to see. Okay, from that aorta, this aorta is very largest artery of the body. Okay, and it will reach the blood reach to the all parts of the body with the help of this aorta. This is the tricuspid valve from the superior region. You can see this is the semilunar valve. This is the aortic valve, bicuspid valve. This is the tricuspid, bicuspid. This is the semilunar, pulmonary. Okay. So I think you understood the concept very easily. So if you have anyone the doubts, you can ask. So here we have the very detailed things is given here. As a summary, you can see epicardium, myocardium, endocardium. These are the layers of the heart: right atrium, tricuspid valve, right ventricle, pulmonary valve, left atrium, mitral valve, left ventricle, aortic semilunar valve, papillary muscles and cardiac antenna, fibrous system of the skeleton of the heart. So basically, you can see here one thing you are observing, I think so. So that is the shortcuts: RA, RV, LA, LV. Whenever you visit the cardiac center, like they will talk to each other, like RA, LA, AV, MV, and mitral valve, tricuspidal, pulmonary valve, like that only. Okay, so that's the reason you have to remember all these names. So next we have coronary vessels. So we'll continue, or any doubts you have to ask. If any doubts, you can ask. Then we have another topic, that is coronary vessels. We'll continue the lecture.
Continue, sir.
Okay. So basically, heart is pumping the blood to the all parts of the body, but heart also need its own blood circulation. So sorry for interrupting. So I will revise all those things in Hindi also for Hindi students. Okay. So basically, यहाँ पे देखिए, चार पांच चीजें ही याद रखना है आपको हार्ट के एनाटॉमी, फंक्शन, फिजियोलॉजी के बारे में, कि ये हार्ट का हमने पढ़ा था लेफ्ट साइड, अब राइट साइड बताऊंगा मैं। सॉरी, ये राइट साइड हमने पढ़ा था, लेफ्ट साइड में बताऊंगा आप। ठीक है। तो लेफ्ट साइड में क्या होगा, आपको डीऑक्सीजनेटेड ब्लड होगा, राइट साइड में ऑक्सीजनेटेड ब्लड होगा। तो यहाँ से ब्लड जाने के लिए एक वेन है जिसको कहते हैं पल्मोनरी वेन। यहाँ पे एक रास्ता है, बंद रास्ता, वो है पल्मोनरी आयोटिक, सॉरी पल्मोनरी सेमिलुनार वैल्व। जब ये कॉन्ट्रैक्ट होता है तो ये ओपन होता है और ये क्लोज हो जाता है, ट्राइकस्पिड वैल्व, ताकि ब्लड वापस ना जाए, ब्लड आगे जाए। ब्लड ब्लड आगे जाके लंग्स में जाके प्यूरिफाई हो जाता है, ऑक्सीजन मिल जाता है, मिलके फिर यहाँ पे पल्मोनरी वेन के जरिए से लेफ्ट वेंट्रिकल में आता, लेफ्ट एट्रियम में आता है, लेफ्ट एट्रियम से लेफ्ट वेंट्रिकल में जाता है विद द हेल्प ऑफ वैल्व। ये वैल्व का नाम है मिट्रल वैल्व। जैसा ही लेफ्ट वेंट्रिकल में आता है, यहाँ पे होता है बड़ा वेजल जिसका नाम है आयोटा। ये लार्ज आर्टरी है बॉडी की, ये आयोटा की मदद से पूरे बॉडी में पहुंचता है। ठीक है। यहाँ पे भी एक वैल्व होता है जिसको हम कहते हैं आयोटिक सेमी लूनार वैल्व। ठीक है। आयोटिक सेमी लूनार वैल्व क्या करता है, ब्लड को वापस आने से रोकता है जब ये कॉन्ट्रैक्ट होता है तो, या रिलैक्स होता है। ठीक है। यहाँ पे भी सेम, ये वैल्व इसलिए रखा गया ताकि ब्लड वापस ना जाए, वापस जाएगा तो उसकी कैपेसिटी से बाहर होगा, कैपेसिटी से बाहर होगा तो इसको कॉन्ट्रैक्शन होने में, रिलैक्सेशन होने में तो तकलीफ होगी। ठीक है। तो ये सब था एनाटॉमी और फिजियोलॉजी। तो ये चार पांच चीजें आपको याद रखना है कि कौन सा चैम्बर किस लिए काम करता है, उनके क्या डिविजन्स है। ठीक है। तो हम अब बात करेंगे कोरोनरी वेजल्स के बारे में। नाउ विल टॉक अबाउट कोरोनरी वेजल्स। So blood, heart is pumping the blood to all parts of the body, but he also needed the na, he also need of nutritions, oxygens, and other hormones which are related to the body. Okay, so here that is the reason we have coronary vessels. Okay, coronary vessels. Coronary vessels means vessels of the heart, important arteries. The right and left coronary arteries are the first bands of ascending aorta just beyond the aortic semilunar valve. The two arteries branch into small arteries and arterioles into capillaries. The coronary capillaries merge to form coronary veins which empty blood into large coronary sinus, then returns blood into the right atrium. The, so here we have, you can see that this is the arteries in red in color or pink in color. This is the veins. So here we have the aorta. From that aorta only you have branches. You can see here. Okay. So this branches, these are here one branch, this is one branch, this is one branch. So from that branch only, we will receive, the heart will receive the blood. Okay. So then the blood receive to the blood will receive from that artery. So you can see this is the branches. Okay. These are the branches, coronary branches. Okay. So from that area only you have coronary veins also. Okay. Coronary vein. Okay. Coronary vein, posterior vein. Okay. Anterior vein, left coronary artery. So, okay. So from that only the blood will reach to the right atrium. Okay. Then only, means one thing is that the first organ which will receive the blood from the heart by itself, the heart only. Okay. Because we have to function the function of the heart. Okay. So likewise branches are there to the whole heart. So what will happen here? Sometimes any clot will occur here, embolism is occur here. Okay, so what will happen? The heart will not receive the blood. Okay, so then what will happen? Heart attack will occur or chest pain, angina pectoris. Okay, ischemic heart disease. Okay, so these are the conditions we will see in uh, mechanism of heart. Okay. The purpose of coronary vessels is to apply blood to the myocardium itself because oxygen is essential for normal myocardial contraction. If your coronary artery becomes obstructed or a blood clot, for example, part of the myocardium becomes ischemic, that is deprived of the blood supply. Prolonged ischemic will create an infarct and an area of a necrotic blood tissue. This is myocardial infarctions, heart attack. So I think you understood coronary artery. So basically, coronary artery is a artery which from that the blood will receive to the heart itself. We have coronary veins also. The deoxygenated blood will go to the right atrium, from that right ventricle to the lungs, lungs to left atrium to left ventricle, left ventricle to aorta, aorta to all parts of the body. From first, it will receive to the heart with the coronary arteries. So if the coronary arteries are obstructed, what will happen? The heart may be stop function, or some part of the heart will stop function. Then the contraction, relaxation is very difficult to the heart. So the patient develop heart pain, breathlessness. Why? Because heart is not receiving that amount of blood which have to be received. If it is 100%, it is receiving 70%. So that's the reason if you are walking, the heart is exaggerated. So exaggeration will happen while walking. So you have difficulty of breathing. Okay, unable to walk long distance or run. So that's the reason. These are the symptoms. Reason is coronary artery blockage. Okay, so I think you understood. As well as in heart and acupuncture also, the heart is the I think the yang organ. Okay, so it is related to the fire. So that's the reason you can able to see, and you can see one thing that the heart attack, whenever a patient complains heart attack, what are the main symptoms? Here, ischemic heart disease came, so that's the reason I'm explaining. The main symptom of heart attack is the pain behind the sternum. One thing, the patient will complain, I have the pain here. Okay. Second thing is that the left hand will he have pain, severe pain in left hand. And the third symptom is breathlessness or sweating. Profusional sweating is the most common symptom in the heart attack. The patient have developed sweating and as well as breathlessness, pain in behind the sternum, and the pain in the left hand. So why we have pain in the left hand? Is it is my question to you. So please, you have to answer that question tomorrow. Okay. So I will repeat in Hindi. So our class will dismiss. सो बेसिकली कोरोनरी वेजल्स जो है ये हार्ट को खुद उसी हार्ट को ब्लड सप्लाई करने के लिए होता है। देख सकते हैं जैसे आप ये डायग्राम देख रहे हैं, ये हार्ट है, हार्ट से ये आयोटा है, आयोटा से ब्रांचेस निकले, एक ब्रांच इधर गया, एक ब्रांच उधर गया, एक ब्रांच इधर है। ठीक है, पोस्टीरियर एंटीरियर जो भी डिविजन्स है, डिविजन्स हुए हैं। तो ब्लड ब्लड हार्ट को सप्लाई करने के लिए ये ब्रांचेस बनाए गए। तो यहीं पर आप देख सकते हैं यहाँ पे वेन्स भी है, ताकि डीऑक्सीजनेटेड लेकर लेफ्ट राइट एट्रियम में जाए, राइट एट्रियम से राइट वेंट्रिकल, उसके बाद लंग्स, लंग्स के बाद लेफ्ट एट्रियम से लेफ्ट वेंट्रिकल, उसके बाद आयोटा की मदद से हार्ट और दूसरे ऑर्गन्स को ब्लड पहुंचाया जाए। सो अगर इन आर्टरीज या वेन्स में ऑब्स्ट्रक्शन आता है तो हार्ट को ब्लड सप्लाई कम होता है, जिसकी वजह से कॉन्ट्रैक्शन और रिलैक्सेशन में मुश्किल होता है। तो मेन सिम्टम्स हार्ट अटैक आ सकते हैं, पेशेंट को हार्ट रुक जाता है, जैसा कंप्लेंट करता है चेस्ट पेन का। पेन जो है आपको यहाँ पे स्टर्नम बोन है उसके पीछे के हिस्से में दर्द होगा, और सांस लेने में दिक्कत होगी, और हाथ खींचेगा, और पसीना बहुत आएगा। तो ये सिम्टम्स होते हैं हार्ट अटैक के, जब हम इमीडिएटली रिस्पॉन्स करना चाहिए। सो फ्रेंड्स, so I think you understood the class, you enjoy the class, so we'll continue tomorrow. If any doubt, you can ask.